set up properly so when it goes on, it's painted in perfectly. The way I explain it to the patients very briefly is if we took a CT scan of your head, we could take the information and we could take a look at you and we say, okay, we're going to take a picture of you. We could program the linear accelerator to put a film underneath the beam, turn the machine on, and on this film it'll paint a picture of your face. On this film we can cut out and put it in your living room. It's perfect. Good. It's unbelievable. You can do the Eiffel Tower. It's unbelievable. Yeah. The key is, though, is that when you program the linear accelerator to make the radiation, you have the image-guided technology so that the beam goes on, it's actually treating that area. And so we've got ways that we immobilize the patient so when it goes on, it's perfect. And it's really a huge advance because we know that radiation works. We always have. It's been the ability to have the technology to give it properly. And this has been a huge advance and a big step up. And the equipment that we have not only can treat larger areas for a patient with a breast tumor and stay off the heart, or a patient with lung cancer and not to hurt the lungs, or a patient with a prostate cancer not to hurt the rectum, but you can treat very small pinpoint areas like 3-millimeter tumors. So a patient can come in with a small brain metastasis and 1 or 2 treatments. You can drive in pinpoint huge doses of radiation and ablate it or sterilize it. You can have a patient with a small lesion in the adrenal gland and come in and localize it and ablate it or sterilize it. You can have a tumor inside the patient's ear and they won't have to have radical surgery. You can come in and program the linear accelerator how to treat it.
You've said something there that I think is so critical to the layperson who walks in the door and says, okay, I've got this thing wrong with me. What are you going to do to help me? That kind of accuracy that you have really changes a patient's outcome, doesn't it?
Well, sure. I mean, if you're going to be able to sterilize the cancer, you want to throw out the baby with the bathwater. You don't want to hurt the patient while you're taking care of the problem. And so all this fancy equipment allows us to deliver the drug, the radiation, with pinpoint accuracy. And treatments are very individualized today. So we've got the equipment here to take care of a broad range of problems that patients present to us with, so that if the patient's got a brain tumor, you can treat the tumor and not hurt the underlying brain. You can stay off the optic apparatus so you don't hurt the eye. When you've got a patient with a bad base of tongue cancer, you can get enough radiation in to kill the cancer and they can still swallow and they can still talk. This is huge advances. I mean, just think years ago we'd have to go in and take the patient's tongue out and give post-op radiation, and nowadays we're able to focus radiation into the tumor and the tongue and kill it and sterilize it and hopefully cure them, and they go and they're walking, talking, swallowing, and they got a life.
You said earlier, and it really struck me, that cancer can take your life, but it could also ruin your life. It sounds like what some of these new, and I don't know if this is the right term for the treatments, but these new treatments keep you, if you survive, if you are a cancer survivor, you don't have to have a miserable life as a cancer survivor. You can have a quality of life.
Quality of life is a big deal. Quality assurance is a big deal, and quality of life is a big deal. We work on both.
Yeah.
We work on both, but you want to have a good outcome. You need to do it in a pleasing way. We need to do what's right and proper medically and as doctors, and we've got the equipment to carry it out, but we need to be decent individuals, decent human beings, understand the emotions and the sensitivities of our patients, and bring it all together to work with them and help them through their issues and through the problems that we're dealing with. So the technology is really important, and the docs and the quality of the docs is really important, but being a decent person and acting properly and treating people in a very humane, sensitive, caring way is really important to us too.
You said something to me before that, and I keep using this term, but when you're talking about someone's life, it's critical to feel this way, that a good doctor also has to be a good teacher. So if I come to you and I know I've got breast cancer and I'm scared, but my family's scared as well. Can you talk a little bit about how you handle that?
Well, sure. Well, we sit down and we go over things individually with the patients. We try to put the information in their own, so they understand it. We need to talk to the patients so they get it. We understand it. We've been trained, we've studied, we're experienced. We need to put it out to them so they understand it in their own words, in their own language. And not just the doctors, the nurses. We've got really fine, experienced oncology nurses, and they're used to dealing with nursing care is really important stuff. Nurses spend a lot of time with the patients. We have wonderful, the nurses are amazing. And So we spent a lot of time doing that. For the breast cancer patients, we had a breast surgeon come to us, Dr. Robin Screen, who was trained at one of the top training programs in America. And she came to us and wanted to set up a breast program, and we were thrilled by that. And she's very gracious, and she grew up in a medical household. Her mom was a nurse practitioner. Very proud of what she's doing, and she wanted some special technology called BSGI camera, breast scintillation gamma imager. And I said, what is it? I didn't know a whole lot about it. And she says, well, Greg, patients get mammograms. If the mammogram's suspicious, you may do a biopsy or you may get an MRI. And the MRI is really expensive. It's a few $1,000s. And she said there's this new thing out called a BSGI camera that's nuclear medicine based. It costs a third or less of an MRI, but it shows abnormal function within the breast. So we can take the patients and walk them through these kind of issues and say to them and very easily get to the heart of the matter. A lot of it's technical. You've got to be able to communicate.
Yeah, absolutely.
You've got to communicate with the patients and their families, and we deal with all kinds of different people. I think you have to sense who you're dealing with. Patients come in with different issues or different people. Some are anxious, some are depressed, some are unhappy, some are very bright and intellectual, some of them are mentally challenged. You got to know what you're dealing with as a doc.
Yeah, I think that whole issue of medical judgment is a thing that comes into play there. If you're talking to a person as opposed to a patient, then you probably get a little bit better communication going.
I mean, we try our best. Yeah. We try our best to do that.
Yeah. I want to ask you in our final moments a little bit about your own background. You mentioned to me that you knew you wanted to be a doctor at a very early age, 3.
Well, my dad's a doctor, and I love my father, and I grew up in a medical household, and I was always going to be a doc, and so that's just how it is. But there's a little bit of drive there. I mean, we have a little bit of drive, and we enjoy working with the people. We want to do a good job. We want to earn a good reputation. We'd like you to be proud of us. We don't want to do anything wrong. We want to be, good citizens. We want to help be part of the community and be involved in the community.
Yeah, that is something that you shared with me as well. When you came to Irving in the early 90s, one of the things that you got involved with right away was, I think it was called the Terry Fox Run at that time.
Sure. Well, Angela Ann Ryan at Four Seasons came over to me one day, and I was working over at the Irving Hospital, and she said, well, we've been doing this. Nobody's really interested in it, Greg. You think you? And I says, well, sure. So we started off on that, and we had a little bit of run, and we raised $20,000 the first year, and I think now they're raising a couple $100,000 a year. So, and the funds are raised to help support the people within the community, help get equipment and programs in place, and it's been a wonderful thing. And we're involved with the American Cancer Society. We have an outreach program here in the Cancer Center that's going to be very beneficial and helpful for a lot of people, educational-wise, with prostheses, with transportation, what needs to be done. We're involved with the local high school. We've done some things to help the kids with their education that we're particularly proud of. We've been involved with the Chamber of Commerce. We've gone out and give talks to the community. So we are part of the community. We've been here for a long time, and we want to be going forward. And I think, a lot of the people out there know me. I've taken care of their loved ones and their families, and we're proud of what we're doing.
Yeah, that's a thing that I've noticed in the facility. Everyone that I've had an opportunity to come in contact with really has a sense of ownership in what you're doing here in terms of what you've done to have quality equipment, what you've done to bring in quality people. And that's a tone that's set from the top. If everybody's feeling it, it's a tone that's set from the top. Why was that important to you?
Maybe it's just who I am. I don't know. We like to be around good people. We feel that if we're around good people, we have a better chance of good things happening to us. Hiring is a big deal. It's hard to hire good people, and I've made mistakes. But if you're around good people that are skilled, talented, interested in what they're doing with good values and want to learn and keep up to date, they're human beings. Not everything's perfect, but if we feel if we're around those kind of people, good things tend to happen to us. You are who you're with. And so we've tried to hire along those purposes. We probably have 50 to 60 employees today. We have 3 medical oncologists, Heidi Jordan, James Mackey, and Corinne Concharo. They're wonderful experience. They've been trained at some top training programs. Dr. Desari does radiation oncology with us. She does a good job, and Dr. Screen, and the program's gradually growing. I would tend to think if we can earn a good reputation, maintain a good reputation, that that's what